Hi, I'm Dr. Rob, and this is the More Than Anatomy videocast where we try and take yoga anatomy to a whole new level. Today, my special guest, my very special guest, is Dr. Amit Anand. He is a faculty member in the Division of Pulmonary Critical Care and Sleep Medicine at the Beth Israel Deaconess Medical Center and an instructor in medicine at the Harvard Medical School. This man is very qualified. He's co-authored numerous publications and chapters, and his current research project is interestingly titled Integrated Yoga, Meditation-Based Therapy for Complex Sleep Apnea, which is one of the main topics of today's talk. So not only is Dr. Amit extremely knowledgeable about the body, and particularly of the respiratory system, but he's also a dedicated practitioner and advocate of yoga, and he's been practicing since he was 5 years old. He and I met a few years ago because we both have the same pranayama teacher, Sri O.P. Tiwari of Kalayavadhamma, Lonavala, India, who is a wonderful, wonderful man and wonderful teacher. And today we're going to really go into great depth around sleep apnea. So if you're a yoga therapist who wants to better understand this condition and also learn some very interesting things about how you can potentially work with this particular condition through yoga therapy, you're in for a real treat because this man, he is a leading expert in it. So with that all said and done, let's get started. We met a few years ago in Kalayavadhamma in Lonavala, India, and we share the same teacher in Sri O.P. Tiwari. I just was curious how you came to know him. How did you learn of him, first of all?
Well, it was many years in the seeking, Rob. I've had my practice in asana, and I've been meditating since I was age 5. But there was a missing part. There was a missing link, if you will. And, being a doctor in pulmonary, critical, and sleep medicine, the thing that interfaces with all those aspects of my practice is breathing. And I realized that breathing was what was really missing on the yoga side. So as I started to look for people who could actually help sort of fill that void, I realized there wasn't a whole lot of instruction going on systematically in the US. And to my surprise, there wasn't a whole lot going on in India also. But I wanted to approach this search with science and safety, as a background. And that's how I ended up in Lonavala, because Kaivalya Dham has always emphasized science in terms of yoga teaching. And I was naturally drawn to Lonavala. It's a beautiful locale. It's just about an hour and a half from Bombay, where I grew up. So it was just sort of, sweet sort of coincidences at that time. And I ended up meeting you in one of the courses over there a few years ago.
And so you've been meditating, been practicing yoga since you were 5 years old. Is that right? So your father or your mother was practicing? How did you get into it?
Yeah, so when I was 5, in India, yoga is all around you. Meditation is a part of our tradition growing up. But we really don't have an appreciation for any of this, as children. My mother was a practicing doctor, but very steeped in Sanskrit, all the sort of rituals and the traditions of, yoga upbringing. And then at age 5, she said, I need to give you a word of wisdom. And as it happened, there was an instructor who was visiting town, and both me and my younger brother actually went and got our mantra. And we didn't know what it meant. But she says, this is your first yoga lesson. And it was my most valuable lesson because, we think of yoga as a physical practice, but mantra is as important, if anything. And so I've been meditating off and on as a child, with mantra until I really realized the value of what I was doing when I was in medical school. And that's when I sort of started getting into asana. Then the asana happened, for the few years following, but sort of mantra was always in the background. So those were the two aspects of my yoga practice, growing up in India and then in the US.
Beautiful. And what's your, as you know, I've been studying with Toroji for about 10 years now, and to me, he's so authentic. He's so passionate about what he teaches and yoga. I mean, tell us a little bit about your experience with this wonderful man.
I was drawn to him from, the first time I sat in his room. In fact, before I came to actually take a course, I had visited Lonavala because I just wanted to see what the ashram was about. And what struck me was, at the time, I think he was in his early 80s. Here's this man who is, 6 foot plus tall for an Indian, with no crease on his forehead, with a spine that's absolutely erect, with a smile that's radiant, and doesn't waste his speech. And I said, who is this person and how does he do it? And then when I sort of met him, he was actually doing administrative work at the time in the afternoon. And I sat with him for half an hour. I said, he is my teacher. And so I made it a point to kind of, come back from the US that year and for a few years following, just to partake in his courses. And every time I came back, it just became so clear to me that, one, this was the missing link, but he was the medium. And the sweetness, with his teaching is that it's not dogmatic. He's not pushing anything down your throat. He just says, this is what's there. This is the interpretation that I give it. Take it or leave it. There is nothing forceful about his mannerism and the way in which he teaches. And that was so sweet and so, attractive to me as a student. And to this day, I mean, I just can't wait to go back to see him, after, the restrictions are lifted in India. My dad still is in Mumbai, so it's kind of a double pleasure, seeing both Dad and Tiwariji when I visit.
Very nice. So when we were chatting recently, and you were telling me a little bit about, when COVID happened, you were really a frontline worker working in the ICU units with the COVID-19 patients, and I can't begin to imagine. I'm sure many of us can't begin to imagine what that was like. As a doctor trying to deal with this virus that was very new. You didn't really know the short-term or the long-term consequences. You didn't know perhaps how it might affect you or your friends or family. It must have been extremely stressful. And so I'm really interested to know how important your yoga practice was for you around that time and how it helped you manage that particular situation.
Yeah, no, it was one of the more terrifying experiences of my life. And I was sitting in the office in February, knowing that the index case had arrived in California a few weeks prior, and the first surge was happening in a nursing home in Seattle. And we looked at each other, our colleagues sitting in that room, and I said, it's just a matter of time before this comes. There's on the West Coast who were dealing with this in Seattle, practitioners in China who had already been dealing with this for about 2 months. And there's this, underworld community of, sharing in critical care where they say, hey, this is what's happening. This is what they're coming with. This is what we're doing. And this is what is not working. And it was frightening because we knew we were just another 6 weeks down the road from Seattle to Boston for this virus to make it to our hospitals. And sure enough, it was mayhem. I mean, March, April, May were frightening months in Boston. Our ICUs were full to the brim. We couldn't take care of our regular patients. Our outpatient clinics completely uh, stopped working, so that we were all basically doing COVID care. Um, and it was frightening because we didn't know what we were bringing home. As much as we were with each other and taking care of our patients, the scary part was, what were we doing to our families? And I used to come home, I used to strip down outside the house in winter, put my laundry away to wash, take a shower first thing I got home, and then, sleep in a separate room from the family, so that, at least while I was doing ICU level care, I could minimize the risk to my family. But it was still breath, right? This is transmissible by air. So there was a lot of stress, but what really held me in good stead was my pranayama practice. I went from being a weekend warrior, if you will, to a daily practitioner. And it was then that I realized that if I made that the work of my day, the rest of my day was actually much more clear, much more precise, much more peaceful. And believe it or not, I was actually sleeping better, because I was physically exhausted during the day. But with pranayama, it kind of just helped me compartmentalize that, okay, this has to be at work. I just need to rejuvenate at night. And I realized that those 35, 40 minutes in the morning and a little bit in the evening after work just helped get me into a very good routine with my practice. And I said, you know what, this has saved me. And so when we had our respite in the summer months, it just became a lot more resonant in my life outside of it, because we were not as stressed. And it really held me in good stead for the second surge that we had in the winter. But by this time, it was like, okay, you know what? There is some clarity here. Let's start spreading the message. I taught students, I taught nurses, I taught my fellows, whoever was willing to, learn and get a few minutes of peace with breathing. And it kind of it's a sweet way of sharing, this wisdom and this knowledge that I had been privy to, for the last 10 years.
That's beautiful, because I think that's for me and around pranayama, that's the beauty when you have a practice which is very much balanced to your particular needs, because all our needs are slightly different. So therefore the types of pranayama that we practice may be slightly different, or the ratios or the quantity of that particular pranayama technique is slightly different. When it's right, I'm always blown away by how balanced it makes me. Before, in the past, I will share with you, in the past, once I ignored what Taraji had taught me. I thought I was ready for some more attentions, and I was practicing a lot, and I developed a lot of anxiety. I even developed a heart arrhythmia, because the attentions were just too much for my system at that time. Now, fortunately, I had a teacher in Taraji that I could call and say, this is what I've been doing, this is what I'm feeling. He, of course, scolded me, but corrected the practice, and again, just balanced me out really quickly. The arrhythmia went, my sleep started to normalize, the feeling of anxiety disappeared off. So that's the power of pranayama, to balance, but also to unbalance if it's not practiced correctly, which is the reason why it's so important to find a teacher that is very knowledgeable in the practice, but also someone who can look at the individual in front of them and know what they need to utilize in their own personal practice.
So true, Rob. So true. And that's the beauty of breath. That's the danger of breath. So the breath sits at the interface between the body and the mind, and, done volitionally, it can help settle the body and the mind. But when the element of control is not there, then it becomes unsafe. And hyperventilation can be a deeply spiritual experience because you start to, feel like you're out of body, but it can be a very dangerous physiological one also, because you're very close to having a seizure if you blow your CO2 down too low. And that was why I was so drawn, to doing it safely, finding a teacher who teaches this safely in a very systematic manner. And that's why, the traditions and the learnings of Tivadiji have resonated so profoundly, with me. There's that restraint. There's that, when he takes your pulse, for example, he knows exactly what's been happening for the past few days or nights, and he can tell you, okay, this is not for you now. This is for you, It was so sweet.
It's very true. And that kind of leads kind of nicely to the one of the main topics that I wanted to discuss with you today, and that was sleep apnea, which is something that you specialize in, which really is disordered breathing whilst you're asleep. Can you, for those that are going to watch this and who are not familiar with that particular condition, can you kind of tell us a little bit about it?
Sure. Yeah. No, sleep apnea is, a clinical entity. It's a clinical syndrome that almost 35 to 40% of the population has at the present time. We just don't know it. It's become more of an epidemic or pandemic, if you will, with the burgeoning epidemic of obesity globally. But there's more to it than just obesity. There are hormonal influences on the upper airway, age-related influences, things that you put into your body that can also affect the way the upper airway responds to stress. So it happens during sleep by definition, and apnea means cessation of breathing. So breathing stops. And there are two varieties of apnea. One is the obstructive component, so somewhere between the opening of the nose and the opening of the windpipe, the upper airway has a tendency to collapse during sleep, unbeknownst to the sleeper. Or sometimes there are issues with central apnea, where the brain controlling mechanisms sort of don't send a signal to the muscles of breathing to actually work. So you may actually not be snoring, but not be breathing at the same time because there's no output to the body. And some of those central apnea syndromes tend to cluster in people who have, cardiovascular disease, neuromuscular disease, neurological disease, or people who abuse, opiates, alcohol, things like that. The obstructive component tends to happen in the upper airway, where, because of airway closure, snoring actually stops. But there are consequences to airway closure in terms of O2 and CO2 fluctuations, which the brain is sensing, and then terminates by telling the body to arouse with a gasp. So an apnea ends with almost like a gasping spell. But with the resumption of breathing, then there is re-equilibration of O2, CO2. But then there's an overshoot of blood pressure and heart rate that occurs with every episode. And so you can imagine if this is occurring very frequently during the hour, more than 5, 15, 20 times an hour, sleep is fragmented, sleep is fractured. So qualitatively, you're going to suffer the consequences of fractured sleep with mood, memory, attention, fatigue, sleepiness. But then there are also cardiovascular sequelae to be had because of every little apnea that's causing a surge in blood pressure and heart rate. This adds up during the night. Blood pressure is actually highest, in the morning hours. And then you can have issues with arrhythmia. You can have issues with hypertension, long-term if untreated, and severe issues with heart failure. Bunch of consequences from a cardiovascular perspective. So there are the neurocognitive issues and then the cardiovascular sequelae with sleep apnea that need to be managed. So it's a huge problem. We see this obviously with people who are sleepy or who have a bed partner that have been worried about their breathing at night, and that prompts medical attention. It's seen in young kids with tonsillar and adenoid hypertrophy. It's seen as one gets older, as I said, because of what age does to the upper airway. It's a big problem in the community, and it's not well diagnosed because not many people think about it. You know, they attribute their sleepiness to fatigue or stress or work, wherein it's actually a breathing problem at night.
Wow, wow. So you said 35 to 40% of people actually have this condition. Is that right?
Adults. Yeah.
Adults.
I
Okay.
mean, the epidemiologic literature will give you numbers anywhere between 9 to 35%, but you know, the real world data will suggest that it's much higher than that, much higher. And you know, especially in your fourth, fifth, sixth decades of life, it's way higher. It tends to sort of have this a little bit of a decline after that. But yeah, it's a huge unmet need in terms of both diagnosis and therapy.
So you mentioned a few things that might lead an individual to seeking help, you know, seeking a diagnosis, and that might be disturbed sleep, or not, you know, waking up in the morning and not feeling refreshed from the sleep, or if they have a partner, them identifying or suggesting they get help. Are there any other things that you can suggest to us that might be a sign that you have sleep apnea?
Yeah, so I mean, most people who have issues with their breathing at night, you know, they're told that they snore. They don't believe it. They only, you know, come to medical attention because they sometimes occasionally gasp with a panic episode at night. They usually wake up dry in their mouth. And if their apnea is severe, they wake up sometimes with a headache, or they wake up profoundly fatigued in the morning. And that fatigue only gets worse during the day. And you can't catch up on that fatigue because every time you nap, you're having the problem again. So you get into a cycle where you're constantly sleepy or fatigued. And every time you go to sleep, you have an issue with interrupted breathing. So those are the classic symptoms. You know, obviously there are certain sort of morphometrics of the upper airway, the nasal anatomy, the mouth, the jaw, the tongue, the neck circumference, which come into play when you're seeing a doctor, that will, you know, raise the suspicion for a diagnosis. And the way the diagnosis is nowadays made is really with the home sleep apnea test. Is, you know, you get this device which you can wear at night. It's a recorder that monitors breathing, snoring, oxygen, heart rate, and ventilation for one night. And these are very accurate if put on, you know, correctly in people who don't have a lot of comorbid disease. And you know, one night in your own bed, you don't need 8 hours of data. You need, you know, 2 hours of data to make a diagnosis if you're actually sleeping. And the doctor or the nurse or the, you know, PA will be able to give you a lot of valuable information with some of these testing devices done at home. A lot of people wear these wearable devices, you know, the Fitbits that track sleep, Oura Rings, Whoop devices, things like that, which are gauges of sleep stability, sleep architecture, but not as accurate as a home sleep test for truly quantifying disease burden. So if there was the clinical suspicion and you had, you know, the exam that goes with, you know, upper airway narrowing, or you have, you know, a comorbid condition like hypertension or an arrhythmia, you probably need one.
Wow. So I've got two questions for you around sleep apnea. One, you mentioned snoring was quite a common symptom of sleep apnea. Could we say that everyone who is snoring potentially has apnea, or is there a certain percentage that you're finding? What would you say around that?
So it's not just simple snoring. It's resuscitative snoring that stops and starts, that speaks to airway closure and airway opening. So we're all going to snore. That's just life. If we're tired, if we've had a couple too many drinks, if we're nasally congested, if we're medically sick from sinus disease, if we have allergic issues, we're going to snore. But snoring that stops and starts, stops and starts, that speaks to closure and opening, closure and opening. And so that's a very different kind of pattern. And that's what really frightens the bed partners, that, oh, he or she's not breathing. Let me nudge them to turn over or breathe again. It's not that they're not breathing. Their muscles are actually working, but ineffectively because the airway is closed. So that's why, waking them up from sleep will have them resume their ventilation again, or they'll just terminate the lack of snoring with a snore. You see? So there's a distinction between snoring and apnea, and not all snoring portends apnea. It's the history of resuscitated snoring that is the worrisome symptom.
Okay, that's a really interesting clue then to perhaps look out for in your partner, or perhaps for a yoga therapist to actually ask that question if they're concerned that there's sleep apnea, to then refer to a medical doctor. As you know, I'm a chiropractor, so I always have my attention always goes to the spine, and I wanted to ask, have you noticed any relationship, because you obviously mentioned lots of different reasons why sleep apnea can develop. Have you noticed any relationship with like anterior head carriage and kyphosis potentially being a factor?
Yeah, so the way I like to think about sleep apnea is that, especially of the obstructive variety, it's a disease of the upper airway. When we're talking about kyphosis, scoliosis, restriction from obesity, those are problems with the lower airway. Yes, you can have shallow ventilation, rapid breathing at night because you're restricted from kyphosis or from scoliosis or from obesity. Yes, their pattern is very different. But the upper airway problems, if I'm looking, for those as it relates to the musculoskeletal system, I'm looking at, the cervical spine down. Are there any issues there? Are there any issues with the jaw, retrognathia, certain, morphometrics of the upper airway, the circumference of the neck, things like that. Nasal anatomy becomes critical for sleep apnea evaluation, because most people are mouth breathers at night when they can't nasally breathe. So what is their predisposition? Are there septums midline? Are they having issues with sinus disease, allergic disease, things like that? What's the size of their tongue when they open up their mouth? What's their overbite as opposed to their jaw alignment? Do they grind their teeth? Is there a concomitant history of bruxism? Are they having issues with reflux, which they think is reflux, but it's actually apnea? So the upper airway evaluation is very relevant for sleep apnea. The lower airway becomes relevant: kyphosis, scoliosis, spectrum deformities, rib cage abnormalities. If you're thinking about something else that would make sleep apnea come to medical attention sooner, because they have limited cardiopulmonary reserve, you see? So they're restricted because of kyphosis, so they'll drop their oxygen levels a little quicker and steeper, even if they have upper airway occlusion. So there's that little bit of a distinction.
Okay, great. So if you've diagnosed as someone as having sleep apnea, there will be certain medical interventions, and you may have also some other interventions that you may use, such as pranayama and asana. Can you tell us a little bit how that might be treated medically, and also what you're finding, how it can be treated more from a yoga standpoint?
Yeah, so if you think about the obstructive component, it's a problem with the plumbing. Simply put, very crudely put, you got to open up the pipe, right? And the best way to open up the pipe is, depending upon the patient and the severity of the diagnosis, is to find some mechanical strut. Whether it's a dental appliance, whether it's surgical intervention on the nasal airway if it's particularly obstructed, or what we use as machines called CPAP or BiPAP, positive airway pressure therapy, with the appropriate mask at the appropriate pressure with inline humidity and a filter just to open up the collapsible segment of the upper airway. So that's the obstructive component. And there are many ways to do that in a given individual patient. Not many people like CPAP. It's very tedious to use, and it's sometimes anxiety provoking because you're sleeping with a mask on your face. And there are other strategies to help deal with some of the other elements that contribute to sleep apnea, especially if there is a component of tongue enlargement or poor responsiveness of the musculature of the upper airway with exercise. There was an observation from Australia a few years ago where they used this wind instrument, called the didgeridoo, and they found that breathing through this instrument actually tones up the muscles of the tongue and makes snoring less. So it's opened up this whole avenue for myofunctional therapy. How do you tone up the musculature of the tongue? And guess what? In pranayama, there are ways to do that. You use a certain mudra. There are certain techniques that you can use to tone up the muscles of your tongue, the upper palate. There are certain breathing techniques like Bhramari pranayama, for example. You're humming on the exhale breath. That can also tone up the hypoglossal muscles, as well as the tensor palatini muscles, that can also have an impact on the way the upper airway responds to stress or closure. Very valuable. And then the overall and overarching aspect of pranayama that is really valuable are in those people who don't have just simple obstruction, but who have this other component of insomnia. It's not just an anatomical issue. There's maybe a breathing control issue, the central component, where they have a mixed phenotype of their apnea. They're almost hyperventilators during sleep, but the obstructive element is only driving part of it. And those people tend to be, predisposed to heightened sympathetic tone in the daytime. So there's the heart rate, blood pressure component that goes with their disease manifestation, where pranayama helps by down regulating the sympathetic axis. And that's how I think that's really valuable, because breath practice, pranayama, or any other kind of routine that helps modulate sympathetic tone in a healthy way can actually help that pattern of insomnia, unrelated to obstruction. And then suddenly people find that, they're sleeping better, even though their obstruction has been well treated, the quality of their sleep improves. So that's where pranayama, some of these other approaches actually can be extremely valuable in a patient with sleep apnea.
So, that's fantastic information you just shared with us, Amit. So toning the tongue, lion pose, may be very beneficial to tone the tongue. It's interesting you said that Bhramari. Is that your experience that it's toning those muscles, or have you seen some research, or how did you come to that finding?
So there is published literature in the Indian yoga journals on Bhramari and snoring. Actually, there's quite a lot. Nothing to my reading that has been done systematically for sleep apnea per se, because again, sleep apnea has so many manifestations: mild, moderate, severe, the other phenotypes that go with the disease. So I think that research needs to happen, because now people are realizing that sleep apnea is not just an anatomical entity. Even though there is the anatomical predisposition, there are multiple other factors that contribute to what we call different endotypes of disease. So different manifestations based on different causal influences, if you will. And it could be that Bhramari myofunctional therapy works for a certain phenotype of disease. And so that kind of research hasn't happened. It's likely going to happen because now there's so much interest in breath, or breath work, and pranayama falls under that rubric.
Beautiful. it also reminds me, as you're speaking about the kind of the stress element and the overactivation of the sympathetic nervous system. Some authorities would say that, I mean, I've heard it as much, I'd be interested in your opinion, but I've heard people say that 95% of disease, or all disease, is stress related. I'm not sure whether it's that high, but many people say that stress element is a big culprit for many conditions that we see, such as heart disease and diabetes in some instances. And I think that's one of the great beauties of yoga, and that's why it works so often, even if we don't necessarily understand what's taking place on a physiological level, as someone like yourself might know from the different tests that you do. Just by winding the system down by simple techniques, you can give a great deal of benefit to the individual. Do you have any comments or thoughts around that, Emmy?
Yeah, I agree. I mean, stress as a factor in all disease manifestation, its role cannot be overstated enough. As a species, when do you think heart attacks happen most? Which day of the week?
Monday.
Monday. At what time? Morning. And exactly, we are the only species that have had the ability to differentiate Sunday from Monday. And work stress is high Sunday night in anticipation for a Monday morning start. And most people aren't happy at what they do. So that simple fact should be a wake up clarion, if you will, to the role of stress, in disease. That's cardiovascular disease. It turns out that there is a similar correlation with a lot of other disease also, breathing issues, for example. I'm sure GI issues. So yes, stress, extremely important as a means of treatment and targeting therapy. And that's why these traditions are so powerful. They're time tested. And they need to be integrated into our conventional model of dealing with disease. It takes discipline, it takes time, it takes a dedicated student and a good teacher, but you don't cultivate the side effects of a drug. No. And it's likely going to give you a lot more stable health long term. We're now more into the metrics of assessing stress, whether it's heart rate variability or whether it's Fitbit monitoring of REM versus non-REM or what have you, some other markers of. But it's a good time to be, because we can now actually make these measures in real time in large population cohorts who are invested in their health, invested in dealing with stress. You just got to show them the right way.
Beautiful. Because I know when we've spoken before, you're very passionate about trying to draw almost your two worlds and the world of, what are your two worlds? The world of yoga, which you've been practicing since you were 5, and obviously you've been very heavily involved or surrounded by the medical profession. You said your mother was a doctor, and obviously you've studied medicine. Tell me a little bit about your research and how you're trying to bring that together, and also perhaps how you're interacting with your colleagues to try and make them more aware of yoga and its potential.
Yeah, so I've walked both worlds, being a doctor as well as a yoga practitioner, and I see the value in both. I see the trust gap between the two, which I'm hopeful will start to sort of bridge itself very quickly, because there are a lot of people in medicine who are interested in yoga, integrative approaches to health. And there are a lot of, my yoga friends who actually want to know what's happening to their body, even though they've been doing asana and pranayama for a long time. what is happening to me, from a physiological perspective. And it's a beautiful time, because I think there are a lot more people in our world, in the medical world, that are trying to understand the language of the yoga world. So I'm trying to sort of move my efforts to studying this in a way that makes sense for both. Maybe the language of medicine needs to change. Maybe the medium of validation for the yoga world needs to change. And research is the way forward. I have been very sort of interested in what it does acutely to the body, pranayama and yoga. So I've been looking at this both individually and some patients that I've taught pranayama in terms of their cardiovascular variables, their ventilation variables, O2 and particularly CO2, looking at nerve output, sympathetic tone, looking at sleep, looking at some of these other variables acutely and then over time. So we're actually doing some work here in Boston, trying to create protocols, fully understanding that this can't be protocolized for everyone because there's an individual component. But how do we do this at a very basic level? And how do we target, say, hypertension? How do we target, say, asthma? How do we target, sleep apnea with insomnia, or other stress conditions, or anxiety disorders, or chronic pain, or IBS, anywhere where the sympathetic system is under extreme pressure? How do you protocolize, pranayama therapy? How do you research that and follow that in time? So that's going to be, the mission of my life going forward, and would love to integrate people like you, who are masters of breath, with, some of my colleagues who are masters at studying the heart or the electrical physiological system of the heart, or, people who do pulmonary disease and sleep disease, so that we can create almost, a lexicon that makes sense for both bubbles.
Amazing. That's a really worthwhile mission. I like your mission a lot, Amit. Tell me a little. When we last spoke, you mentioned just a moment ago CO2, and you were talking about something really interesting, which really got my attention. Was the fact that you exposed your body to high levels of CO2 and your reaction around that. Can you just tell us a little bit about what CO does in the body, and perhaps how pranayama changed it, and also your experience of working with high levels of it?
Yeah, so I mean, the first paper that really caught my attention was in 1981, Rob, and I think I shared this with you when we were in Lonavala. It was an observation on Belgian yogis and yoginis who had been practicing pranayama for some time, anywhere between 4 to 7 years. And their breathing pattern was investigated, both at rest and while doing Ujjayi pranayama. And their breathing pattern was very different from the average person. So normally human beings tend to breathe half a liter times about 10 or 12 breaths a minute, for a minute ventilation of about 5 to 6 liters. That's the amount of gas you're exchanging in your airway. And that gives you a certain O2 level, that gives you a certain CO2 level in your bloodstream. These yogis and yoginis were breathing 3 to 4 times a minute at 1.5 liters. So their actual minute ventilation was lower than 6. 3 times 1.5, 4.5 liters. Their oxygen saturations were perfectly fine, but the only way they could maintain this habit was by having a slightly higher CO2, because they were literally hypoventilating compared with the average person, right? And they were perfectly healthy. So there was no adverse effect of having a slightly higher CO2 at rest. And pranayama, actually, if you think about it, in what we were studying in India, with breath extension, with breath holding, modulates CO2. It makes O2 exchange perfectly stable. You're not at risk for dropping oxygen saturation, but it modulates CO2. And so the obvious question is that safe? Is that healthy, both in the short term and in the long term? We know that that's the long-term pattern. How does it change acutely? And so that's what I've been looking at, is that with, a ratio breath of 142 or 132, how does CO2 change? And what happens to the heart rate and the blood pressure? It turns out that it's perfectly stable, even with slightly elevated levels of CO2. The only two clinical situations where you would not want to have CO2 go up would be if you're having a migraine, because you'd vasodilate to your cerebral system, or if you have a brain tumor, where you don't want edema from vasodilation to the tumor. Otherwise, CO2 is perfectly fine. We do it in the ICU all the time. When people can't breathe, we put them on low tidal volume strategy for ARDS. One of the consequences of that strategy, CO2 has to go up. Well, we have to sedate them so that they don't feel the urge to breathe, because that's what happens when your CO2 level goes up, is you feel like, oh, I got to breathe. But in time, you adapt to CO2, both at a physiological level and at a psychophysiological level, so that you don't feel the panic that goes with CO2 retention. And with time, we think, that we will be able to replicate those Belgian yogis and yoginis, who will also likely have a lot of other variables that are healthier than the average human being, whether it comes to blood pressure, heart rate, sleep, disease states. You're just using more of your reserve during your practice and during your wakeful state, so that you're less likely to get into trouble, because now you have this tool at your disposal when you do get sick. We're all going to get sick. It's how do you respond to illness? And I think this is where these techniques can be of value.
It's really interesting. It's a point that people are getting to understand more and more, and that's the fact that it's not so much the O2 which is important in the pranayama practice. It's not that we're getting more oxygen in, it's actually we're regulating or controlling CO2 levels more, and the beneficial effects or the impacts that has in the body. And I think more people are becoming aware of that, whereas maybe 5 or 10 years ago, everyone was still talking about it's the O2. So it's CO2 is really, really important. Tell me repeat that little story that you told me about, where you exposed your body to a high level of CO2 and your response.
Oh yes, sorry about that. Yeah. So I actually, we generate these ventilation responses to low oxygen and high CO2 in the lab, sometimes just to measure the slopes of ventilation. So one of the ways of doing that is to measure your ventilation response to a CO2 mix. So, 5% or 7% CO2 mix. And as soon as you get on that CO2 chamber, that circuit, you're breathing, because you can sense it. It's almost like, I need to clear this. I'm getting panicky. Well, when I don't do pranayama and I just use my normal response, which is now difficult to do because now I've learned pranayama, the slope is high because I'm breathing an irregular, rapid, large volume breath just to kind of get rid of the CO2, and I fatigue much quicker. But when I do ujjayi, even at a 4 cycle in, 4 cycle out, so an 8-second breath, I can tolerate that CO2 exposure for 2 minutes longer at much higher CO2 exposures and not feel panicky. So there's something magical about the way you breathe on ujjayi, even though you're exposed to a lot of stress, that is, allows the practice to go on for a little longer and doesn't cause that level of anxiety or panic. I'm not saying that this is for everyone. No, I'm not saying it. All I'm saying is that there's a way to breathe under stress that can actually make it more efficient for you and less stressful for your cardiovascular system. You see, I mean, the ultimate um, experience of a pranayami, if you had to look at it from a purely physiological one, is the breath hold diver, right? They're in kumbhak, they're not breathing, but they expose themselves to profound stress by diving, and their lung volumes change, and their O2 and their CO2 relationships change profoundly, but they're not breathing. This is way below that level. But trying to train the healthy individual and then probably the patient to breathe in a different way, so that they modulate their response to CO2 without getting panicky, while keeping exchange efficient. So that was the exposure to CO2, that my slope to CO2 was here. My slope without Ujjayi was here. There was a marked difference. And I felt no stress when doing Ujjayi on a 7% CO2 mix.
And that response, or your lack of response to that elevated CO2, that's really your nervous system staying in a parasympathetic state and not being elevated, and perhaps stimulus of the vagus nerve by a more controlled movement of the diaphragm. What were your feelings around that?
Yeah, so it's tough to know, because that's sympathetic storm, no matter which way you put it. When you're exposed to CO2, your sympathetic system is going to get revved up very quickly. But it doesn't rev up that much, likely. I mean, your blood pressure, heart rate are going to elevate. But there's also some level of adaptation that's occurred at the level of the brain, which allows you to tolerate that exposure. Now, you can't really track, parasympathetic tone while doing that practice, because the stress of CO2 exposure is so profound. But if you had to compare it ad hoc, without someone who was doing Ujjayi on a 7%, mix, you'd probably see a big difference between what's happening with blood pressure and heart rate. And those are sort of indices that are used for gauging the balance of sympathetic versus parasympathetic. What's happening with respiratory sinus arrhythmia, what's happening with heart rate variability, things like that mark the parasympathetic output of the axis.
Okay. Fantastic. Really, really interesting. I mean, we're kind of running over a little bit of time. Just one more question, because I know you got your family there and you probably want to spend some time with them over the weekend. But just one more question, and that was, you're heavily involved in research, and I just wanted to ask you one of the questions perhaps that you're desperate to try and answer, or you're excited to try and learn more about in your future research.
Yeah, so I think pranayama research needs to happen, especially in patients with disease states. We need to be able to figure out a way in which to make this a part of their treatment algorithm, or armamentarium. That's the big missing link, where if we can introduce a practice that helps lower the dose of a drug or eliminate it altogether without naturally disturbing disease control, that would be hugely beneficial for any human being. So I think the research needs to become a little more specific for disease states, with the utilization of breath, just like we were talking about snoring, Brahmari, and sleep apnea, something like that. What elements of this beautiful practice can be compartmentalized for a given disease state? That's, I think, where I would like to see this. And in the ICU setting also, I'm an ICU doctor, I would love to have some kind of a treatment algorithm using pranayama, even though we are now controlling their breathing, they are not doing it themselves, but in a way that in the waking state or in the spontaneous state is helpful. Can we translate some of these protocols into a ventilated patient, with or without COVID, doesn't matter, that reduces their sense of anxiety, that reduces their sense of air hunger when they do get sick, you see? So I think that would be the natural extension of some of this work. But I'm excited that, people in the medical sphere over here are interested. They're wanting to learn the language of yoga. And we need people like, you, all our brothers and sisters, in the yoga community to encourage and support them, prod them along without being too critical of the allopathic tradition, because it's a powerful one, but it's not perfect. It's incomplete. We just need their help and support to sort of move our efforts along.
Amazing. I really could speak to you all day and ask you so many more questions. I mean, it's really beautiful to chat to you, and I'm really excited about, especially with your position in the medical community and your passion for yoga and how you're going to be able to draw those two worlds together. I think it's great. I really, really do. Thank you so much for joining me and having this chat. And I'm sure I'm going to be trying to persuade you to have another one in the not too distant future.
My pleasure, Rob. Great to see you, and be well.
Thank you so much, Amit. You take care.